If you have trouble sleeping, you've probably tried all the tips and tricks. Everything from cutting out blue light before bed to dramatically reducing your caffeine intake throughout the day, or just weird breathing exercises at night, or goofy meditation apps, all sorts of stuff. But if you're here watching this video, there's a good chance that stuff hasn't worked as well as you would like. So what do? You need something more powerful. No, not drugs. The approach I'm going to suggest is 100% natural and behavioral. Hi, my name is Nick Wignall. I'm a clinical psychologist, and I have spent years in my practice helping people sleep better and overcome their insomnia for good. The technique I'm going to share with you comes from a protocol called cognitive behavioral therapy for insomnia. It's based on decades of research that time and time again show that it's the most effective way to overcome insomnia and get back to sleeping well, even though almost no one knows about this, including a lot of doctors and therapists. In the rest of this video, I'm going to teach you the most powerful component of that protocol, which is called sleep compression. What is sleep compression? Sleep compression is a technique for improving sleep quality by temporarily spending less time in bed. Now, you hear that, you're probably thinking to yourself, but I have insomnia. Why would I want to spend less time in bed? See, instinctively and understandably, people who have insomnia or who struggle a lot with their sleep, they usually try to spend more time in their bed. They think, okay, I'll get into bed earlier, and I will sleep in a little bit longer just to maximize my odds of getting a good, sufficient amount of sleep. Unfortunately, this approach really backfires because it means spending a lot of time in bed, not asleep or relaxed, but anxious and frustrated. The core problem with insomnia and most people's sleep issues is that they have unintentionally trained their brain to associate their bed with stress, frustration, and anxiety, in large part because they're spending a lot of time in bed, too much time in bed. And when you spend time in bed and you're not sleepy, you're gonna start worrying and getting frustrated and problem solving. And again, that's gonna train your brain to associate the bed with stress, arousal, anxiety, frustration, all this stuff that is the exact opposite of what you want when you get into bed and lay down. The problem long term with this is, eventually, if you do it enough, even if you're not stressed or anxious, the minute you get into bed, your brain associates that activity, again, with thinking and stress and problem solving and anxiety and arousal, and it makes you aroused and stressed and anxious, even though you weren't beforehand. Again, because you've spent too much time in bed associating your bed, for your brain, with arousal. Sleep compression is designed to undo this learned association by temporarily exchanging reduced sleep quantity for increased sleep quality. And as a result, changing the way your brain thinks about bedtime. How to do sleep compression. Now, like many challenging but worthwhile things in life, sleep compression is simple, but not necessarily easy. Here's how it works in a nutshell. Step number one, you're going to reduce your total time in bed each night to between 5 and 6 hours. Now, after a few nights like this, you will find it much easier to fall asleep and stay asleep because you're so much more sleepy, understandably, because you've reduced or compressed the amount of time that you're spending in bed each night. Step number two, stick with your new sleep compression window until you're sleeping well for at least a week or two. So this means you're falling asleep within 5 or 15 minutes and that you're staying asleep throughout the night. Maybe you get up, a little bit once or twice, but then you go back to sleep relatively quickly, okay? Now, importantly, you must adhere to your new sleep window no matter what, including no matter how well you slept or didn't sleep the night before. This is very challenging because there is a good chance you will only sleep 4 hours one night and you will feel pretty awful the next day and that night. You're going to want to go to sleep at 7:30 p.m. because you're so tired and sleepy from not getting, a good night's sleep the night before. It is essential, though, that you stick to the plan and only get into bed during your new sleep window. Step number three, slowly expand your sleep window in 30-minute increments. Once you are consistently sleeping well for that new sleep window time, whether it's 5 or 6 hours, if you're sleeping well most nights for at least a week, then you can add 30 minutes to your sleep window. So if you were going to bed at midnight and getting up at 6, Now you can go to bed at 11:30 and get up at 6. And then you essentially just repeat the process. But you have to stick with the new sleep window, again, until you're sleeping consistently well for at least a week. Then you can add another 30 minutes. And you repeat this process until you get back to your optimal or normal amount of sleep each night, usually like 7 or 7.5 hours for most people. Common questions about sleep compression. Isn't it dangerous to only sleep for 5 or 6 hours per night? I get this one all the time. Now, the first thing I would point out is that very often, many people with insomnia and chronic sleep issues, you're only sleeping 5 to 6 hours per night anyway. You're spending 8 or 9 hours in bed, but 3 or 4 of those are spent lying there awake, worrying about not sleeping, what the consequences of not sleeping well are, etc. So there's a good chance you're not actually sleeping much more than 5 to 6 hours anyway. The second thing I'll point out is that there is no good evidence that temporarily sleeping 5 to 6 hours per night has any detrimental effects on your long-term health. Okay, and if you think about it, for hundreds of thousands of years, human beings, in particular women, have been having babies. And when they have babies, the vast majority of them do not sleep real well for the first 3, 4, 5, 6 months of that baby's life. They are probably only sleeping 5, 6, maybe 6.5 hours per night if they're lucky. So again, this is a very normal thing. Human beings are incredibly resilient and adaptive. And remember, this is a temporary thing. You're doing it at most for a couple of months, okay? Much less than most new moms who have a crying infant who wakes them up, 14 times during the middle of the night so that they can feed. And then finally, I just want to reiterate this point. Remember, sleep compression is not something you do for the rest of your life. You do it temporarily. You compress the amount of time you spend in bed so that you can retrain your brain to associate your bed with rest and relaxation and sleepiness, and get rid of that old association between your bed and anxiety and frustration. So it's temporary. Again, you're doing it for anywhere from about a month to 2 months is pretty standard, big if you really strictly stick to your sleep window. Is sleep compression different than sleep restriction? The original name for this technique was sleep restriction, but many people, myself included, prefer not to use that term for a couple of reasons. The most important one is it's not actually technically accurate because you're not restricting sleep so much as the amount of time you spend in bed. That's the thing you are directly limiting. Now, there's also a variation on this technique, of this old technique of sleep restriction, that was called sleep compression, but it was used a little bit differently. The idea with sleep compression was instead of immediately reducing your sleep window to like 5 or 6 hours, you would gradually lower your sleep window by increments of 30 minutes or so down to, say, 5 or 6 hours. And then once you were sleeping well, you would gradually increase it again. My experience, and the experience of most professionals I know who work with folks with insomnia, is that sleep compression in the traditional older sense is not super effective, so we don't really use that anymore. But I have found that the name sleep compression is really useful because, again, it describes more accurately what you're doing, and frankly, it's not as terrifying as sleep restriction, which just sounds kind of like awful and gnarly. So I use the term sleep compression to describe what was traditionally referred to as sleep restriction, but it's essentially the same technique, but sort of rebranded in a more helpful way, I think. Is it better to set my sleep window for earlier in the night, like let's say go to bed at 10 and wake up at 4 a.m., or later in the night? So go to bed at midnight and get up at 6 a.m. In general, this decision should be a function of your chronotype and your lifestyle. So in other words, if you're an extreme night owl who normally doesn't go to bed till much later in the night, it makes more sense to begin your sleep window later in the night, like midnight, 1, even 2 a.m., because that aligns more with your natural biology and when your body wants to fall asleep according to your circadian rhythms. On the other hand, if you are a real lark and an early bird, and naturally you tend to get sleepy much earlier in the evening and normally wake up earlier in the morning, it makes sense to start it earlier in the evening. The other thing to keep in mind is lifestyle. Regardless of your chronotype, if you just have a job where you have to be up at 4:30 every morning, then obviously you're going to set your sleep window according to those lifestyle constraints you have. All right, I hope you found this video instructive and interesting and potentially helpful. If you want to learn more from me about how to get better sleep, I have a few resources for you. So the first one is I created what's called my Sleep Compression Quick Start Guide. So if you heard this, but you're like, that was a lot to keep track of, how do I remember what to do? I put together a nice little 4-page PDF that includes a step-by-step breakdown of the basic steps of the protocol, including some more kind of questions. I answer a lot more questions than I did here that people often ask about sleep compression, and then another page with kind of a more expanded list of resources and tools for improving your sleep. So if you want to check out that sleep compression quick start guide, just go to sleepcompression.com. It's this little mini site that I maintain, and you can download the guide there. And then lastly, I will just say, I have another video I did about a year ago with a good friend of mine and insomnia expert, Dr. Daniel Erickson. And in this video, we talk about our favorite sleep tips for high achievers, people who are kind of type A, strivers, super goal oriented. In a lot of ways, this can actually make you more vulnerable to insomnia and sleep issues. So if that sounds like you or sounds like something you'd be interested in, check out this video right here.